Hey everyone, welcome back to another video in my series on the ICD-10-CM coding guidelines. Today we're going to be going over Chapter 4, which is Endocrine, Metabolic, and Nutritional Disorders. We'll also be covering Chapter 5, which is Mental, Behavioral, and Neurodevelopmental Disorders as well. So I just got the new 2021 ICD-10-CM book. It's the AAPC version, so that's going to look a little bit different today. So let's hop on down to our chapter for our endocrine, nutritional, and metabolic diseases section. Let me scroll back up here so you can see better. So this starts a lot with diabetes. So chapter 4, the biggest thing that you're going to find in there is our diabetes codes. So this first section says that diabetes mellitus codes are combination codes, and they include the type of the diabetes, so type 1 or type 2, and the body system affected and any complications affecting the body system. And then of course we have a default code that's just unspecified diabetes. You use as many diabetic complication codes as you needed that meet that description. The only thing you can't do is use an unspecified code and then use specified types of diabetes. So if they have multiple complications like a diabetic ulcer and diabetic nephropathy, you would code both of those combination codes because they both report different types of those complications related to the diabetes. And they need to be sequenced based on the reason for a particular encounter. So you assign as many as needed for that encounter and sequence them based off of the reasons for that encounter. Type of diabetes, we often think of type 1 as being juvenile diabetes. They call it that because it often occurs prior to the patient's puberty, but that factor alone is not why we are selecting the type of diabetes. If the type of diabetes is not documented, it defaults to E11, which is type 2 diabetes mellitus. Now, if the documentation in the medical record does not indicate the type of diabetes, but it does indicate the patient uses insulin, we still use type 2 diabetes, but then we add on an additional code from category Z79 to identify the long-term or current use of insulin or oral hypoglycemic drugs. If the patient is treated with both oral medications and insulin, only the code for the long-term use of insulin should be utilized. Now, this information that's in bold is new for 2021. If the patient is treated with both insulin and an injectable non-insulin anti-diabetic drug, then we assign codes Z79.4 for the long-term use of insulin and Z79.899, which is other long-term drug therapy. If the patient is treated with both oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug, assign code Z79.84 with long-term use of oral hypoglycemic drug, and Z79.899 other long-term current drug therapy. Code Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 patient's blood sugar under control. So if they're not normally under the use of insulin, but we have one episode that was just kind of an unusual episode where we were trying to get their blood sugar under control and they are given insulin temporarily, then they don't use code Z79.4, which is that long-term use of insulin or current use of insulin. As with everything else, our codes from Chapter 15 take sequencing priority, so make sure you check those out for those patients that have diabetes in pregnancy and gestational diabetes. On to complications due to insulin pump malfunction. So underdose of insulin due to insulin pump failure. An underdose of insulin due to an insulin pump failure should be assigned code from subcategory T85.6, which is mechanical complication of other specified internal and external prosthetic devices, implants, and grafts. That specifies the type of pump malfunction as the principal or first listed diagnosis. Followed by, so after that, we use a code for T38.3X6, and then that 7th character extension, underdosing of insulin and oral hypoglycemic anti-diabetic drugs. Additional codes for the type of diabetes mellitus and any associated complications due to the underdosing should also be assigned. Underdosing of insulin due to an insulin pump failure. The principal or first listed code for an encounter due to an insulin pump malfunction resulting in an overdose of insulin. So this is the key here. So this one, it was a pump malfunction and it resulted in an overdose. So the first listed diagnosis should be T85.6, mechanical complication of other specified internal and external prosthetic devices, implants, and grafts. And then the code for that unintentional poisoning. So the T383X1, seventh character extension for poisoning by insulin and oral hypoglycemic drugs, accidental, so unintentional. Secondary diabetes mellitus, so codes under categories E08, which is diabetes due to underlying condition, E09, drug or chemical induced diabetes, and E13, which is other specified diabetes mellitus, identify complications and manifestations associated with diabetes mellitus. So secondary diabetes is always caused by another condition or event, such as like cystic fibrosis, malignant neoplasm of pancreas, pancreatectomy, adverse effect of drug, or poisoning. And then this category here, the secondary diabetes mellitus and the use of insulin, is basically the same as the primary one, so Z79, to identify any long-term or current use of insulin or oral hypoglycemic drugs, and then it talks about if they're using the oral medication and insulin, and then also if they are using insulin and injectable non-insulin, and then the oral hypoglycemic and injectable non-insulin. So these are the same codes as the other one. And then again, it also says code Z79.4 should not be assigned for temporary bringing down of a patient's blood sugar levels with the use of insulin. Assigning and sequencing secondary diabetes codes and its causes. So the sequencing of the secondary diabetes codes in relationship to codes for the cause of the diabetes is based on the tabular list instructions for categories E08, E09, and E13. When a patient has secondary diabetes due to a pancreatectomy, that results in a lack of insulin due to that surgical removal of the pancreas, we assign code E89.1, post-procedural hypoinsulinemia. And then we assign a code from category E13 for the diabetes and a code from subcategory Z79.41, which is acquired absence of pancreas, and that's the additional code. If the patient has secondary diabetes due to drugs, secondary diabetes may be caused by an adverse effect of correctly administered medications, poisoning, or sequela. So just check those codes in Chapter 20 for the external cause code reporting. Secondary diabetes due to drugs, check on chapters 19 and 20 for those coding for adverse effects of poisoning or external cause code reporting to appropriately assign the adverse effects. The other thing I want to discuss in regards to diabetes before we move on to Chapter 5 is that diabetes with. So if you look under your alphabetic index for diabetes, where it says here diabetes and with, anything that comes under that term with in the alphabetic index assumes a cause and effect relationship. So let's take a look here and see. I'll flip over so this is a little bit easier to read. So for example, if the provider documents number 1, diabetes, number 2, ketoacidosis, you can assume it's diabetic ketoacidosis and assign code E11.10. Or for example, the provider documents number 1, diabetes, number 2, retinopathy. Because the term retinopathy is here under that with in the diabetes, you can assume that cause and effect relationship and assign the code for diabetic retinopathy. Definitely check out the coding clinic in relationship to the diabetes and the diabetes with, because there is authoritative guidance in regards to coding for the diabetes codes. Now let's go on to Chapter 5, our codes for mental, behavioral, and neurodevelopmental disorders. So assign code F45.41 for pain that is exclusively related to psychological disorders. There's an excludes one note under category G89, which is our pain category codes, that says you should a code from G89 should not be assigned with that F45.41 code. But when we're coding for F45.42, which are pain disorders with related psychological factors, then we should use a code from category G89, which is that pain not elsewhere classified, if there is documentation of a psychological component for a patient that has acute or chronic pain. For mental and behavioral disorders due to psychoactive substance use, if it is in remission, selection of codes for in remission from categories F10 through F19, mental and behavioral disorders due to psychoactive substances, those are our categories F10 through F19, and those as extensions with 0.11 and 0.21. Those require the provider's clinical judgment. The appropriate codes for in remission are assigned only on the basis of the provider's documentation as defined in the official coding and guidelines and reporting, unless otherwise instructed in the classification. Mild substance use disorders in early or sustained remission are classified to the appropriate codes for substance abuse in remission, and moderate or severe substance use disorders in early or sustained remission are classified to the appropriate code for substance dependence in remission. Psychoactive substance use, abuse, and dependence, when the provider documents, refers to use, abuse, and dependence of the same substance. So if it's same substance of alcohol, opioid, or cannabis, for example, so they say patient has alcohol use, abuse, there's special sequencing orders that we have to consider. So if, for example, we'll use alcohol. Provider documents, patient has alcohol use and alcohol abuse, you would only sign the code for abuse. If the provider says alcohol abuse and dependence, we only would assign the code for the dependence. If they document alcohol abuse and alcohol dependence, we assign just the code for dependence. And if they document alcohol use and alcohol dependence, we only assign the code for dependence. So when they document both of those, basically all of them default to dependence, except for when they document use and abuse, then we just code for abuse. But basically dependence and anything else defaults to dependence, use and abuse defaults to abuse. Psychoactive substance use, unspecified, as with all other unspecified codes, the codes for unspecified psychoactive substances, and they give the whole code range there of the F series, should only be assigned based on the provider's documentation and when they meet the definition of a reportable diagnosis. These codes are to be used only when the psychoactive substance use is associated with a physical disorder as described in Chapter 5, such as sexual dysfunction and sleep disorder, or a mental or behavioral disorder such as a relationship is documented by the provider. Fictitious disorder imposed on self or Malfunction syndrome is a disorder in which a person falsely reports or causes his or her own physical or psychological signs or symptoms. For patients with documented fictitious disorder on self or Malfunction syndrome, assign the appropriate code from subcategory F68.1, fictitious disorder imposed on self. It is by proxy MSBP, which we are familiar with the case of Gypsy Rose, which is where her mother, or in other cases it might be a caregiver, they falsely report or cause an injury or illness in someone else, that person, the victim, under his or her own care, such as a child, an elderly person, someone who may be taken care of that has a disability. The condition is also referred to as fictitious disorder imposed on another, or fictitious disorder by proxy. The perpetrator, not the victim, receives that by proxy definition. The victim, so the person who is suffering, the patient suffering from that person who's inflicting that problem on them, we would assign for the victim a code from T74, which is the category for adult and child abuse, neglect, and other maltreatment that's confirmed, or it would be T76, adult or child abuse, neglect, and other maltreatment suspected, if it's a suspected condition. So that's it right now for chapters 4 and 5. Next week we will start with chapter 6, diseases of the nervous system. I hope you found this video helpful. If you did, make sure you give it a big thumbs up. Don't forget to subscribe and hit that notification bell so you'll get alerts when I post new episodes. I will see you in the next episode, and until then, just keep on coding on.